Dr. Arya AR presenting anatomy and physiology of oblique muscles and pulleys.
Good afternoon. At the outset, let me thank KSOS and Dr. Divya Kishan for giving me such an opportunity today. My topic is anatomy of oblique muscles. So this is a lateral view in which you can see the recti muscles coming from the common tendinous ring of Zinn and coming forwards, and superiorly you can see the superior oblique muscle and the inferior oblique muscle. So coming to superior oblique, it is the longest and thinnest muscle. The direct part is about 40 millimeters, and the reflected part is 19.5 millimeters, and it originates from the body of sphenoid from above and medial to the optic foramen. It moves forwards between the roof and medial part of orbit. Once it reaches the trochlea, it turns posterolaterally and it gets inserted behind the equator. The reflected tendon passes under the superior rectus muscle and fans out. So the primary action of the muscle is intorsion, secondary is depression and abduction, and the anterior fibers are mainly meant for intorsion and the posterior fibers for depression. So in the adducted position, it acts as a depressor, and in the abducted, it causes intorsion only. And this is a picture from above, which shows the recti muscles going, and this is specifically the superior oblique muscle. From the superior view, where you can see it is originating from the body of sphenoid, coming forwards. Once it hooks the trochlea, it turns posterolaterally at an angle of 54 degrees and then gets inserted onto the sclera behind the equator. This is a lateral view. This is again the lateral view of the oblique muscles getting inserted. Coming to the inferior oblique, it is the shortest muscle. It is around 37 millimeters long. It is only EOM extraocular muscle attached near front of the orbit. It originates as a rounded tendon from the orbital plate of maxilla, just lateral to the orifice of nasolacrimal duct, talks laterally and posteriorly around the globe and passes between the inferior rectus and floor of the orbit. The primary action is extorsion, and secondary is elevation and abduction. And at 51 degrees of adduction, it's only an elevator, and 39 degrees of abduction, the action is only extorsion. So this is basically a slide to show you what is intorsion, that from the 12 o'clock to the medial position. And now this is a small video. It's an animated video showing the origin and insertion of the oblique muscles. So the superior oblique is noted in blue color, which passes under the superior rectus, and the inferior oblique is denoted in green color in the video. Now, as I have already told, it originates from the body of sphenoid, comes forwards, runs parallel to the medial orbital wall, above the medial rectus muscle. Once it reaches the trochlea, it passes posterolaterally and then it gets inserted, passes under the superior rectus muscle, it fans out and then inserts into the sclera behind the equator. So the superior oblique actions are depression, abduction, and intorsion, and the superior oblique is supplied by the fourth cranial nerve, that is the trochlear nerve. Now it is the inferior oblique. It is the only muscle that comes from anterior part. The video you can see it is denoted in green color. It passes backwards. And gets inserted into the sclera as shown in the video. This is the lateral rectus that is shown above. And the actions are elevation, abduction, and lateral rotation. and the inferior oblique is supplied by the third cranial nerve or oculomotor nerve. And coming to the blood supply, there are two for each recti except the lateral rectus, which receives only one branch. That's about the recti, and as shown in the chart, the inferior oblique is supplied by the medial muscular artery and superior oblique by the lateral muscular artery. Now coming to what are these muscle pulleys. As the extraocular muscle penetrates the Tenon's capsule, the connective tissue forms the sleeves around the muscles, excuse me, creating muscle pulleys. And these are discrete rings of dense collagen tissue encircling the extraocular muscles, and they are about 2 millimeters in length. And the pulley redirects the muscle and acts as a functional origin. It also prevents displacement of the muscle during the movement. And just to show the action of the superior oblique and inferior oblique, in dextrodepression, it is your right inferior rectus and left superior oblique acting. And in levodepression, it is your left inferior rectus and right superior oblique. Coming to dextro elevation, it is your right superior rectus and left inferior oblique, and levo elevation, left superior rectus and right inferior oblique. So last point about the fixed axis, that is how the extraocular movements takes place. Along the x-axis, elevation and depression takes place. And along the y-axis or the anteroposterior, torsional movements, that's the extorsion or intorsion takes place. And z or vertical axis, adduction and abduction. Thank you.
Thank you, Dr. Arya. Now,